I'm joined this morning by my fellow non-executive director, Dr. Paul Cassian, and our Managing Director and CEO, John Kelly. Our US non-executive directors, Dr. Kurt Labelle and Deborah Neff, are joining us through the webcast. They're on the east and west coast of the US respectively. And we're also joined by a number of our team here, including Anna, Will, and Chandra, COO and CFO and Head of Sales and Partnerships and EMEA for us. My address was released on the ASX in accordance with the listing rules earlier today, and I'd like to just share some comments with you and then pass to John to add his comments on the CEO's address. So on behalf of my fellow directors, I warmly welcome you to Atomo Diagnostics Annual General Meeting for 2022. We gather here on the lands of the Gadigal people of the Eora Nation. The Eora lands reach west to the Nepean and south to the Georges River and north up to the Hawkesbury. To my fellow New Zealanders, tēnā koutou, tēnā koutou, tēnā koutou katoa. I'm joined by fellow directors, our company secretary, our auditors, and Atomo senior executives. I'll shortly ask you for your involvement in considering a number of resolutions. Let me first, though, talk about Atomo's financial performance for the financial year to June 30, 2022. And then about the year ahead, inviting John Kelly, Atomo's CEO and Managing Director, to address that in further detail. It's with considerable relief that we see signs of the COVID-19 pandemic easing. As a community, our accelerated adoption of rapid diagnostics allowed decentralized testing to serve all of us as a first line of screening. In the hands of individuals, rapid testing reflects people exercising a greater level of control over their health, strongly complementing established testing in clinical settings. In the workplace, employers deployed rapid tests as a fundamental aspect of assisting their staff's well-being. Atomo played an important role in supplying more than 1 million rapid COVID tests during that financial year. The public health response to COVID-19 accelerated profound changes in the use of rapid diagnostics. And these changes are enabled by decentralizing diagnostics and sample collection without a loss in the accuracy of results. Atomo's long-standing belief, and so our strategy, is to fundamentally improve the availability, the speed, and accuracy of rapid diagnostics. For those of you who are amongst our newer shareholders, and these are very old shareholders, let me talk a little bit about what we do in rapid diagnostics. Atomo develops, commercializes, and supplies devices for rapid diagnostic testing. We sell finished rapid tests for professional users and consumers, and our tests detect infectious diseases, chronic health conditions, and consumer wellness. And Atomo participates in 3 identified markets in the development of the commercialization of diagnostic devices. These markets are infectious disease testing, OEM plus, as we call it, devices, and consumer health and wellness. Each of these markets involves Atomo's scaled deployment of our patented technologies, often through partnering. Let me start with infectious diseases. During the 22 financial year, we began partnering with the Australian Pharmacy Guild, making our rapid HIV self-tests available over the counter. This arrangement followed the Therapeutic Goods Administrator widening approved sale guidelines beyond the more discreet online sales channel that we had been using. In global health, a very well-established market for us, our continuing relationship with Viatris Inc. sees growing numbers of in-country approvals, permitting the marketing of our HIV tests, and that's particularly amongst developing countries. In the OEM plus market, during the year, we supplied devices to NG Biotech, Access Biotech, and Lumos Diagnostics to house their own proprietary rapid tests. Our third market, consumer health and wellness, is changing quickly. We view the accelerated adoption of rapid diagnostics during the COVID-19 pandemic as a watershed moment in the decentralizing of screening diagnostics. This conclusion is supported by the extent of user take-up and acceptance by regulators and public health authorities. Atomo's product development continued throughout the year. We excitedly announced the extension of our diagnostics products, adding swab and saliva devices to our blood-based lateral flow device collection. And as with all Atomo products, the design of these devices prioritize user ease and accuracy of results for users. Their mechanisms incorporate essential Atomo IP. Atomo's extended portfolio valuably underpins our engagement with existing and prospective partners. John will shortly share with you how we are positioning in the decentralizing of diagnostics and sample collection and our devices' role. Our planning for the 2023 year drew part from what we discussed during our last AGM. At that time, we talked about the appointment of senior executives and directors. We're delighted to have welcomed San Diego-based Jim McManamy as Head of Business Development and Partnerships, and London-based Anna Tucker, Vice President of Development for EMEA. We celebrated Chandra Sukumar's promotion to COO, following an extensive internal and external search, and we thanked UK-based Mark Smith, as Mark retired as our long-standing COO. On behalf of Atomo's board of management, we gratefully acknowledge the tireless efforts of those who provide us with services. Varun Kapanda, our company secretary at Boardroom, Grant Hummel of HWLE, Gareth Few of BDO, Canaccord, Bell Potter, and Alex Munro, who helped draw together our annual report. See there. Atomo's board of directors shares substantial commercial governance and industry experience across critical aspects of our business. Amongst the board's priorities, ensuring that we have the capabilities and domain expertise to govern our global business effectively. And as a board, we review regularly our composition to ensure that we have the right skills and experience to deliver shareholder value. The balance of our board, outside of John and me, is Deborah Neff, who's on the line, Paul Cassian, who's with us, Kurt LaBelle, who's online as well. And Deborah chairs our People, Culture and Remuneration Committee. Paul chairs Audit and Risk, pillars of our corporate governance, and I sit on those committees as well. You will be shortly asked to consider Paul and me for re-election to the board, in keeping with Atomo's board process. In closing, I share the board's strong recognition of the Atomo team's commitment to developing and implementing company strategy, while making sense of and realizing new opportunities. John Kelly's tireless leadership, his executive team at Will Suter, CFO, Chandra Sukumar, COO, Jim, Anna, lead our work with partners and customers. The decentralization of health services, diagnostics and care accelerated with the COVID-19 pandemic. The adoption of rapid diagnostics has changed users' behaviors and expectations of testing by location, speed to results, and timelier prescription. These changes align with Atomo's proven competencies. Atomo's competitive positioning draws from our product and commercialization expertise. We are excited about this year and those years ahead. Now welcome John to talk about what we're up to in a little more detail. And I thank you for your enthusiastic support, your questions, and interest in Atomo. John, if I can pass to you.
Thank you. First, I'd like to take the opportunity to thank the board and shareholders for their continued support through the year, and also to thank all of our staff who have worked tirelessly to help grow the business through the year, especially as we look beyond COVID and more internationally in our focus. We'll just start by going through, I think, an important piece of information. That's really, why Atomo's here. We're here to empower people to enjoy healthier lives, and that's not just people in developed markets. We're very focused on making sure that our technology is affordable and made available globally. And we do that by really delivering next generation solutions that address challenges that are inherent in kit-based rapid testing. And we've been very successful in showing that our devices minimize errors and really add usability to the process. And that's through discipline in a number of values that are really important to the business: delivering impact globally, being innovative and delivering new solutions that add value, and dealing with integrity in everything we do, and being very collaborative, not just with our own global team, but with partners. We're very much a partner-focused organization, whether that's commercialization partners or community stakeholders that we work with for testing. And excellence is something hopefully that shines through in everything we do. We're very proud of that. Quick recap on the year that's just been. We had $40 million of revenue, over $16 million of cash receipts, for the year, we continue to see growth in the underlying business, and that really reflects the fact that this technology has only really come to market in the last year or two, and we're still getting market awareness of the solution out, particularly post-COVID in the US. We do still have a good cash on hand balance, and that's been through the judicious use of capital as we've tried to grow, but to grow sustainably. And we do have a lean organization. Our operational expenditures less than $1 million a month, and most of our capex has now been deployed. We don't need to invest further significant capex into the business at this stage to be able to continue to grow revenue. And I think that's, given market conditions, a very good position for us to be in. If we could just recap on some of the key achievements that we've been able to deliver this year, I think the key one is that we've now got our manufacturing platform installed and validated at scale, and the capex required to do that has been spent. So there's not a lot of additional requirement there in terms of cash. We're now able to make up to 18 million units per annum at scale, and we have our second generation blister machine fully built and being qualified here in Sydney. So we're really able to now start to turn that capacity into revenue as we build customers on the platform and start to roll out. And that really reflects a transition of the business now at the end of this year from investment in capacity to investment in customer acquisition. And that has seen us refocus our efforts to more commercial activities with the onboarding of senior executives in Europe and the US to really drive that. We did participate in the COVID-19 response in Australia, and we're very proud of being a leader in making that rapid test response meaningful in Australia, both in terms of our lobbying of government to move beyond PCR, which has limitations, as you all know. And with that opening up of the market, we feel that we helped Australia be more flexible in its response to the pandemic, and we also were able to generate more than $10 million of product sales through that process. But now that the pandemic has come under some level of control, we, like a lot of diagnostic companies, are stepping away from COVID and really going back to our core focus, which was not selling COVID tests, but really delivering to market best-in-class user devices. And we're continuing to expand that goal, that journey, that focus beyond blood into swab testing, and beyond swab testing into saliva and blood collection. We've also, as I mentioned, invested into a commercial scale-up of the business, and that's really acknowledging that the vast majority of the opportunity for us is outside of Australia. And that was hard business to grow during COVID, in part because every diagnostics customer we had was focused on COVID, and we had blood testing solutions for them. And the other challenge obviously was that we were locked in Australia and couldn't go meet any potential new customers. Both of those have changed. The market now is looking beyond COVID. The large diagnostics companies are very focused on repositioning their capacity into non-COVID products and moving into consumer-focused solutions. And both of those, I think, afford us great opportunities as a partner that can offer them not only the world's best blood testing devices, but also moving forward a range of other devices in applications like saliva and swab and others. We have the integrated swab device now developed, not commercialized, but certainly developed. Initial usability testing and performance testing in lab indicates that it adds significant value to swab testing. It provides a much more concentrated sample to an assay, and we believe that will deliver better sensitivity and performance in swab-based assays. And that opens up applications like COVID, flu, strep, sexual health, swab-based applications and others. So we're very excited about the longer term opportunity as we bring that product to market. And to do that, we obviously need to have capital. We've got a strong balance sheet to allow us to deliver that. And we've got a very experienced and motivated team that we believe gives us the tools to now deliver. So it's been a busy year, but we're very pleased with where we are. In terms of the business more broadly, you know, what makes Atomo special from an investor perspective? I think we have, you know, a really unique approach to delivering products to market. We move beyond the science into the user experience, and we were the first company really to come to the diagnostics market with that user focus. And I think it's given us a head start in the market. And And that was a head start in a market that didn't really value usability because home testing wasn't really a thing 10 years ago when we had the idea. But the pandemic's really transformed that now, and every diagnostics company in the world is talking about home testing in a way that they didn't previously. And I think we're well positioned now to show them a solution that's been developed in advance of them getting to where we were in terms of that strategic focus. We believe that we've got an experienced team, a very committed board, and the balance sheet to now deliver as a business. We're proven as global innovators. There's no other company in the world delivering these types of solutions, and I think that's increasingly becoming evident to the companies we're talking to in the US, that the time, effort, and cost to try and get to where we are is challenging for these companies. And obviously, we've got a platform that's ready to go, that's validated, that's de-risked, and that means that we can now start to execute on partnership agreements that we think will add long-term value to the business. Our capital spend in terms of scale up of manufacturing is complete. That means we don't need to go back to the market and try and raise more money to get the product commercialized. We're already at scale, and that allows us now to start to monetize that capacity through contracts. And the last point, I think probably for me the most significant, is that the landscape now for diagnostics testing is completely different to pre-pandemic. Telehealth's now one of the largest growing segments in the US for delivery of healthcare. Regulators are open to reimbursed home testing. Insurance companies are prepared to pay for home testing. That was never the case before the pandemic. So really the landscape has changed, and it's moved into the part of the spectrum where Atomo has its strength. So I'm hugely excited about the strategic opportunities that the pandemic has inadvertently opened up for us, and that is a move from lab-based to home-based testing that's irreversible and will only accelerate from here. This slide really talks about why we think we're successful at what we do, and I think it's because we've brought together a number of key areas of strategic competency that never were brought and focused on diagnostics. We have experience in detailed product development, human factors, consumer-centric design thinking, and product validation, having come from the number of the executives that come out of ResMed. So we bring a big company approach to a market that was quite fragmented, and that's allowed us to provide a real fresh approach to these types of solutions. And our goal is fairly simple. When we bring a product to market, we want it to make the products that are currently in that market look obsolete. And I think when you compare the bits in a box kit that was previously the market leader before we came, I think our solutions do that, and I think we continue to be disruptive in being able to do that, and that's what really adds, I think, for shareholders, the strategic value in Atomo. And that is easily articulated but hard to deliver, and we've proven, I think, adept at being able to do that to a level that's world class. We make our products look and feel fit for purpose. They're easy to use, they're intuitive, and most importantly, users are happy to use them and happy to recommend them. And as healthcare moves from hospitals to the home, the user becomes more important, and as you transition to home testing, the user becomes critical to the success of any product. And it's by us being able to focus on meeting those user needs that we are able to be, I think, in the long term, very successful. So how do we know that we're meeting user needs? The user tells us. The user feedback's critical. That last one is my favorite. That person would rather pay for our test than use the free one that they're given currently by the government. So when you can compete with free, you've met your user requirements. And that is, to me, that's more important than the clinical sales sheet or the diagnostic sort of improvements. It's really showing that users love the product, and if users can do it well, then they do it right, and if they do it right, they get the right result, and the regulators are happy. So it's a circle that doesn't work unless the user can do the test. We've been able to take that know-how and deliver the world's best integrated blood test devices. We realized during COVID that a lot of the opportunity was not in blood, and we pivoted very quickly into redeploying our IP and our know-how to deliver to concept stage and then into verification, an integrated swab test device that really adds value in that swab segment of the market. And Once that product's commercialized, we will have expanded our addressable market quite considerably, because we'll now have solutions in blood and swab testing, and that gives us much better coverage. We've established that that device provides a clinical improvement in the applications that it's used for, and we're now in the process of working to secure a number of diagnostic partners that have tests in the market that they can look to re-verify with our device, and if those results are good, then there's an expectation that they'll look to help us qualify and launch those swab accessories that they can then use in the market. And that also gives Atomo the opportunity to go back and look at developing and launching its own finished products with that device as well. With blood, we've launched our own finished products. We do have a business where we sell those cassettes to other diagnostics companies, but equally, we are focused on launching our own products, and that gives us a bigger share of the value chain. We've proven with HIV that we can get Class 4 approvals, which are the highest class of approval in diagnostics, and that then de-risks it for all of our other customers. NG Biotech's launched a very innovative rapid blood test for pregnancy that shows pregnancy up to a week earlier than a urine-based test, and that's been sold in Europe in emergency settings to screen women coming into A&E before they can go for a CT scan, and also it's used extensively in consumer health applications, particularly for women on IVF treatment that want to understand their status as soon as they can. We're working with NG to try and expand that market reach beyond their current markets, and using them as a bit of a case study to go out and start to offer this solution to other diagnostics companies. And post-pandemic, we're getting a much better reception as these other companies refocus on consumer health and move beyond COVID. So we expect that to be an ongoing growth driver for the business. The other thing that the pandemic has shown is that regulators and reimbursement authorities really want to understand what home testing is happening. If it's going to be reimbursed, it needs to be traceable. So what's become apparent is that some sort of connectivity from the home back to the healthcare system is important. We've been working now for over a year on an app that is user-friendly. We've got a version that clinicians can use. It was rolled out in Australia for our antibody test for COVID. But more importantly, the self-test version has now been verified, and that allows users to do the tests at home instead of a paper-based IFU. They've got multimedia instructions. It's much more intuitive. But more importantly, it captures the result. It can accurately determine the result much more repeatably than the human eye. And it can also provide, we believe, some level of quantitation. So rather than just a yes or no, it can start to measure line intensity and give you some understanding of the level of reaction that's been recorded. And that allows home testing to start to move up the value chain. So rather than just saying, yes, you've got something, or no, you don't, it can, we believe, start to be used to monitor at home. And there's a range of things that could be monitored: vitamins, thyroid, all sorts of long-term monitoring at home as the healthcare system tries to push testing into the home to remove the burden on primary health and clinical services. A lot of the market, however, for testing is currently in the doctor office and clinic. So what we're doing is taking our device and reconfiguring it to make sure that it's compatible with common readers in the field. So we're looking at doing a version of the cassette that can clip into existing readers, and that allows us to then go to these manufacturers and offer them an Atomo branded version of their product that they can then use for their business opportunities as well. So both of those are critically important, I think, to the long-term attractiveness of our solutions. So what does that mean in terms of business and growth and revenue? Well, as John mentioned, we've got three areas of focus. The first one is finished products, where we bring our own products to market. HIV is the first of a number, and we'll be announcing in the coming months what those other products are and who the partners are. We're very excited about that. Outside of that, there's a big world out there for rapid testing. We can't, with our resources, realistically launch 30 different tests. So what we're looking to do is, in areas where we don't have a strategic interest for our own products, we offer the device off the production line to other companies. We've had a couple of companies pre-pandemic take that product and get it registered themselves. So we have our version of the product, but they also have theirs. And that allows us to now say to the market, look, this can be done. There's examples of companies that have done that successfully, and we're now going to scale that up. And Jim McManamy in the US, one of his core goals is to really grow that OEM channel partner business for us. And then, as John mentioned, the small but very rapidly growing opportunity is this transition from doctor office to home office health. And there's a lot of companies, particularly in the US, that have had very, very significant venture capital support to grow those businesses. And that's really trying to offer, over the next 5 to 10 years, an online doctor service so that you never need to go and see a physical GP again unless you need to go see a specialist. And with telehealth and home diagnostics and reimbursement, that's a model that's now viable and one that we're very excited about, because that's where we really do hit the sweet spot in terms of offering that home use experience that really adds value. And we're looking at a range of different tests that we think are going to be of long-term value there. We are starting to see a re-engagement from OEM customers. That's one of our engineers in the lab building a small batch of prototype products for a potential customer to do a validation on. They're testing that. They're stripping our device against their standard device. Obviously, there's a usability improvement. They want to verify that there's also a performance improvement, or at least no reduction in performance. And if that goes well, then we would be hopeful of a full supply agreement. And they're one of a number of inbound inquiries that we're now starting to work through and prioritize. And that then brings us on to our commercialization strategy. What tests do we want to bring to market ourselves? Well, really, the idea here is to find the sweet spot where all of the key elements are known. We want to make sure that we've got a clear regulatory pathway to market, and that regulatory pathway for home testing is now much easier to navigate than it was before the pandemic. We want to make sure that we've got the right partners that can provide the chemistry for the test. So we want partners that are manufacturing at scale. We want partners that have FDA and CE mark approvals already in place. We want to make sure that the opportunities are sustainable. The problem with an emerging market is there's not a lot of market history to rely on. So before we pick a test, we want to make sure there's demand there. So we're talking to channel partners, we're engaging with doctors, we're talking to consumers and running consumer focus groups to really understand, of these 20 potential tests, which 2 or 3 would someone actually log on to the internet and buy and use at home. And then finally, we're trying to establish channel partners. We don't want to take all of the risk of trying to fund the product to market. We can take it through to an approval, but ideally we have a channel partner on the other side that's committed to the distribution and promotion of the product in the field, particularly in the US, because that's a very expensive undertaking. And we've had, a really, really encouraging response from a number of potential channel partners in the US, and we're looking to try and close them out in the coming months. And what that allows us to do when we've kind of assessed those 4 boxes is really understand what's the product, what's the demand, who's our partner to deliver it, and who's our distribution channel network partner. And once those are all there, we can then, pick the 2 or 3 opportunities that really add the biggest value and have the least risk. And that's really what we're trying to do. And we've been working on that for probably 6 to 9 months. We're very close now to finalizing that and hopefully announcing some of those agreements. And that brings us through, I think, to the sort of the outlook for 23 and beyond. I'm personally very encouraged. Obviously, we have core business that we want to scale. Current OEM business, we've got up to 18 million cassettes ready to go. So we want to have OEM customers taking product off the line. We also want to continue to expand our HIV business globally. We're looking to launch a professional use version of the product into key markets, and Anna's made good progress getting some distributors lined up for that in Europe and later in the year, hopefully the Middle East. That vending machine is a vending machine at an Australian university that sells our HIV self-test in the student union as part of sexual health support for students. We're looking to expand that across Australia and then use that as a model for our partners to expand overseas. We're starting to see a lot of growth in Australia on HIV, albeit off a small starting base, but that's quite encouraging. One of our biggest challenges was a lot of companies, particularly in the US, hadn't heard of us, didn't know us, weren't familiar with our product. That's because we're small, because for the last 3 years, all the conferences were cancelled. So we've been putting a lot of effort into getting out to market. I've been to the US 3 times this year. Jim's there permanently. We are making significant efforts to make the market aware of what we offer, because once they see it, they know it's better, and then the conversation becomes so much easier. We'll continue to support that commercial awareness, and The good thing about having spent our CapEx is we can now focus our capital onto commercial brand building and awareness. And that, I think, will lead to significant engagement with the market. We've also refreshed all of our collateral, our website, and made the company and the marketing and the collateral just better, more fit for purpose, more professional. And I think as you move up the food chain and you're talking to the bigger multinationals, that perception is really important, critically important, that we look like we can, you know, punch above our weight in terms of being a partner for those types of companies. And we continue, obviously, to focus outside of blood. We're committed to getting the swab device to market in the next 12 months. We are also looking to expand our finished test menu. We'll be announcing 1 or 2 new tests in the coming months, and hopefully in parallel with that, a number of new OEM customers coming onto the platform. And then beyond that, we're starting to look at what the future holds beyond blood, beyond swab, and the 2 areas that we're interested in, but not quite ready to announce because we're still working on concept, finalization, saliva, and at-home blood collection. They're 2 areas we think we can add a lot of value as well. So that's the roadmap, that's the vision, and with your support, we believe we can get there.
Thank you, John. We're now going to move on to what we've called voting and questions. So some resolutions to pass for your vote and also welcoming questions. Let me just explain a little about those procedures. All resolutions will be considered by way of a poll. Which shareholder present has received a voting card from Link Market Services on registration? And please indicate your vote on each resolution by putting a tick or a cross in the yes, no, or abstain box next to the applicable resolution. And please be advised that I will vote any undirected proxies given to me as chairman in favour of all resolutions. Okay, if anyone needs a pen, Kath is our guru. She can help you with all those things. So, yeah. Right, thank you. All polls will be conducted following the reading of all resolutions. So I'll direct you to the poll box at the conclusion of the meeting where you can put your yellow form. And the voting forms will be collated by our share registry, and the results will be posted as an announcement on the ASX. Okay, so we recognise the AGM as an important platform for shareholders to engage with us and ask questions, and we warmly encourage you to ask questions. Questions will be called for after the reading of each resolution. When I call for questions, could anyone wishing to ask a question or make a comment, please firstly raise your voting card. That's your yellow card. No, well, yellow card, we'll go with that. And when called upon, please state your name you're holding, and then ask your question and or make a comment. Questions should come to me as chair. Please limit questions and comments to one matter at a time, just so that I can kind of get that right, understand what you're asking. And the meeting will only consider those questions that relate to the business of today's meeting. And please, I reserve the right as chair on your behalf to rule questions as not relevant to the meeting as out of order. Okay, so that now moves us to our first item. There it is, which are our 30 June FY22 financials. So the first item on the agenda is to receive and consider the financial statements that were circulated and made available. They include the director's report and the auditor's report by way of our annual review for the year ended June 30, 2022. Financial statements were subject to an audit by our auditors BDO, and we are delighted to have Gareth Hugh, partner, and Andrea Diaconescu with us this morning as well. I'll now take any questions on Atomo Diagnostics financial statements and allow you this opportunity to ask any broader questions you may have on the business as a whole. We have Will Suter, who is our Group CFO, with us as well to answer questions. So I would, well, any questions?
Hi, so Richard Dale, John, the number of shares?
No, just that's all good. Yeah, thank you.
So first of all, preface my question with long-term supporter and believer in Atomo, love what you're doing. Just have one question. I'm reading the accounts. There's a line item in the expenses called professional expenses and consulting fees. I don't know what that is, and it's been going up, so it's quite a significant extent. So could you maybe elaborate on what composition that is, please, and whether it's going to contribute to the future?
Yeah, no, there's a broad range of professional fees related to accounting, legal, and consulting. and part of that was where we needed outsourced support. But John, I think we've brought considerable number of those resources internally over the course of the last sort of 3 to 6 months, and so we should expect to see them going down into 23. John, I don't know whether you want to tell that in terms of the resourcing.
I think that we, as a newly listed business, needed a certain level of professional support to get through that initial post-listing period. And also we had a number of consultants that we were using to provide specific amounts of work that once completed were not sort of needed ongoing. So there has been over the last 6 months a very significant reduction in the use of consultants, and I do think as a result we will see moving forward a fairly significant reduction in the costs in that area.
So, excuse me, Chair, go to that question. So, well, what kind of professional service? In the medical area or the?
No, a good question. So we had some consultants helping us with business development and market entry strategy and activities for the US. And once we employed Jim McMenemy as a full-time executive, we then reduced the need for those consultants. So some of those consultants were providing services while we were looking for permanent executives. And now that Jim and Anna have joined, our need to support that short term with consultants became less of an issue. We also had an investor relations advisory consulting arrangement post-listing. As we became more familiar and more experienced in the post-listing environment, we were able to kind of use them less and take more of that in-house, so that the executive team are managing more of that directly. So we're just, I suppose, maturing as a company and removing the need for external consultants where we can.
I think also we did have an industry specialist diagnostic consulting group help us with some of the early landscape assessments.
Business development assessments and stuff.
Yeah, to support that. So I think that's been really helpful in terms of us understanding how to prioritise our spend as we move into 23, but that's behind us now in terms of that work.
So is that possible that part of expense can be R&D expense, research and development expense?
No, although we do get some credit with the Export Marketing Development Grant, so there is an opportunity to get some government support for that, but generally that doesn't meet the R&D criteria.
We have separate R&D activities that are fully eligible that we have, but a lot of the business development stuff's not. Trying to generate sales is not R&D eligible. Yeah.
That answers the 3 questions we've been asked. Yes. Do we have any more questions specifically on our FY22 results as presented? No. No? Okay, thank you. There being no further questions, let me now declare the financial statements and director's report as duly received and considered at the meeting. Good. Yes. All right, thank you. We now move on to item number 2, which is the first resolution. So this is where you get to vote. And we'll move to the resolution. The first resolution is an ordinary resolution for the re-election of Dr. Paul Cassian as a director of the company. The resolution is displayed on your screen along with proxy votes received in favour for this resolution. As mentioned, I will vote the undirected proxies in favour of the resolution. I was going to add a little bit about how much I like working with Paul, and he very bravely joined us just before IPO, but I'll leave Paul to actually talk for himself. But I now invite Dr. Cassian to address the meeting. Paul, over to you.
Thank you, John, and good morning, everyone. It's an honour to serve on the Atomo board. I believe I have the right experience to contribute to the board and serve as your representative. I'm an experienced executive and company director with experience across biotechnology, financial service, and fintech. I also have experience with large successful companies, but also companies that are at the very early stages of their growth and the various different dynamics they have to deal with. On the board, I provide leadership, governance, capital markets expertise, and strategic direction. I also serve as the chair of the Audit and Risk Committee. Outside of Atomo, my current commitments are as a non-executive chairman of IDM, which is also listed, and a non-executive director of Secura Therapeutics, which is unlisted. I believe that my experience both as an executive and as director gives me the appropriate background to contribute to the board. I appreciate your consideration and continued support. Thank you very much.
Are there any questions on this resolution? No. Okay, so you'll see that you have you'll see that you have the opportunity to just to vote on that. Now move to item number 3, which is resolution number 2, which relates to my re-election. So as you know, under the Atomo governance arrangements, we put ourselves up for a re-election every couple of years. And as resolution 2 relates to me, let me hand the chair for the purposes of this resolution to Dr. Cassian. So Dr. Cassian is assuming the chair here.
Thanks, John. This resolution is an ordinary resolution for the re-election of John Keith as the director of the company. The full resolution is displayed on your screen, along with the proxy votes received for this resolution. I, as chairman, will vote the undirected proxies in favour of the resolution. I will now invite Mr. John Keith to address the meeting.
Thank you. As a non-executive director of Atomo Diagnostics and its chair, I seek re-election from you, and I do so to help contribute to Atomo's success based on robust strategy, results, and effective governance. I'm seeking to best represent your interests as shareholder in the company's success and advocate for your interests as shareholders as we look through to the opportunities available and seize those opportunities. I believe that I have requisite technical skills and experience to contribute to Atomo's success. And as we continue to evolve as a company, I very much welcome the opportunity to continue the role that I have.
Thank you, John. Are there any questions on this resolution? Thank you. I will now pass the chair back to John.
Thanks, Paul. Thank you. Thank you all. We're now moving to item 4, which is resolution 3, and that is an advisory resolution for the adoption of the remuneration report. The report, which explains the board's policy in relation to the nature and level of remuneration paid to directors and key management personnel. Please have a look at our annual report for these details. The remuneration report forms part of directors' report in the annual report for the year ending June 30, 2022, and that's been sent to all of you. The resolution is on the screen with proxy votes received for the resolution, as you can see on the screen, and I will vote the undirected proxies in favour of the resolution. As you consider this resolution, can I ask if there are any questions? No, thank you. Okay, we now move to item number 5, resolution for equity grant for John. It's an ordinary resolution to issue and allot 666,666 options under Atomo's employee option plan to John Kelly as part of Atomo's remuneration scheme. The scheme is designed to reward John's execution of the corporate strategy needed to deliver returns to shareholders over the medium to longer term. The resolution is displayed on the screen along with proxy votes received for this resolution. I will vote the undirected proxies in favour of the resolution. May I ask if there are any questions with respect to this resolution? No, thank you. Okay, if I may ask, now we turn to the poll, which is your chance to do some work, but you complete your voting card and hopefully you've all got a pen and you can pull those in. And if you haven't done that already, and lodge your proxy form into the poll box. Excellent, excellent. The official link poll box. It's not, you know, they will go and count these votes and share them with our company director. And obviously we're just collecting those from you. Thank you. Has everyone had the chance just to hand their proxies over to everyone? We're okay.
All directors as well, yeah.
All directors, yeah. Thank you. Okay. I now declare the poll closed. Okay. We actually now move to close the meeting, which the results of the poll will be announced to the ASX following the meeting. And if there are no further questions, no other matters, no other comments to raise? No? No? Okay, then I would very much thank you for joining us this morning. Ladies and gentlemen, that concludes the business of the meeting, and to whom we're okay to declare the meeting closed for 2022. Thank you very much.